a comment like, oh, you find people jobs. And I do work rehab, so that was a good jumping off point for me, because I could say, no, I don't really find people jobs, but I help people get prepared so that they're in a better position to be able to look for jobs, so that their physical abilities, their cognitive abilities, and everything is improved from having an accident or illness, so that they can then go look for jobs. Then, as time went on, I would ask, the first thing I did is say, I'm from the American Occupational Therapy Association. Do you know what occupational therapy is? And about 5 years ago, people started saying, yes, my aunt had occupational therapy, or my brother was in a car accident, or they kind of had some familiarity. That made it a lot easier for me to then say, well, if your brother was in a car accident, I bet that this is the kind of stuff that they did, or can you tell me a little bit about what you saw? Did you ever visit him in the hospital? And so when you have that response, that makes it easier, because you have a point where you can kind of jump off. If you get a blank stare, what I like to talk about is, how does occupational therapy, how would it affect that person? Now, I'm sure you've learned by now that the Hill is run by 25-year-olds. Has anybody mentioned that to you? The staffers that you're going to see, the average age is about 25 or 26. When you go in there, it's rather shocking. The first time I went in there and saw, this person who was like a lot younger than me, when we interviewed for the fellowship, one of the first questions they asked was, what would you do if a 25-year-old staffer asked you to make a cup of coffee? And I said, I'd ask them if they want 1 lump or 2, and hope that they knew what that meant, because they're 25 years old and nobody uses lumps anymore. So that's kind of what you're dealing with. Now, they're very bright, and they know a lot about what's going on here. They're just very young, so they may not be experienced with things like occupational therapy. So how can you relate occupational therapy to a 25-year-old, or the age of the person who you're talking to? In some offices, you might see a fellow like me, and that person may be a physician, a professor, have a PhD in rocket science, or something that got them on the Hill for a while, because the Hill operates with a lot of fellows, which are basically people who kind of know something and are free. So they may know more about it. They may think they know more about it. So you have to kind of, who am I explaining OT to? So how would we take occupational therapy and relate it to a 25-year-old? Many of you in the audience here, like the Howard folks, some of you probably are 25. So if you think about what's important to, what are the occupations of a 25-year-old? Suppose you were in an accident tomorrow and you couldn't go out dancing anymore. One of the things that occupational therapists do is we might help you learn how to do that again. Some of you may know who Ben Vereen is. He's a star of stage and movies. And when he was in an accident, he talks about how occupational therapists, I don't remember the quote, it was a great quote, but it was something like, make you stronger, and physical therapists make you stronger, and occupational therapists teach you how to dance, because that's what his OT did. That was his occupation. So, 25-year-olds, they like to go out dancing and drinking and whatever else it is that they want to be able to do. So you can kind of relate it to that. Suppose you were in an accident, you couldn't do that. Occupational therapists give you your life back. Occupational therapists help you to be able to do the things that you need to be able to do that are important and significant to you in everyday life. It might be going out and dancing. It might be putting on your shirt or brushing your teeth or putting on your shoes and socks. You might also relate it to Senator Johnson. Anybody know who Senator Johnson is? Anybody from Dakota? Senator Johnson had a stroke/intracranial bleed kind of thing. I don't know the exact diagnosis, but that happened in December. And he's coming back, and he made a speech on the floor, was it last week or the week before? What? Last week. And so he's now in a wheelchair, and he's doing things very differently. His speech is a little off, and you can talk about how one of the reasons Senator Johnson is able to be back in the Senate, if you saw his speech last week, is because he had occupational therapy. And the occupational therapist helped him to learn how to do things, again, that you need to do to be a senator. Like writing things down so he doesn't forget them, having his desk rearranged so that he can sit behind it, moving things around. Talk about the environment, about changing the person, changing the tasks, the way tasks are done, and changing the environment. And you can use Senator Johnson as an example, because they're going to be seeing him around a lot. He's now using a wheelchair. He made a very impassioned speech on the floor, and he got rehabilitation. So that would be another thing. Or you can talk about children and helping children learn to learn, and the things that kids need to be able to do, that a child's occupations are play. So occupational therapists work with kids, and they help enable them to play. So it might be, there might be some spiritual stuff, if being able to practice your religion, if that's something. I have a very dear friend who, I did a qualitative study looking at what quality of life was, and to her, one of her occupations was going to church, and she couldn't sit in a church pew because she has this very weird condition where she had a bone replaced in her leg and something's loose, and that's very disturbing to her, that she can't go to church. She just can't sit. She can't get up, and she can't sit and she can't get up, and there's no way we tried. And so it may be something that's a spiritual thing to people, that's something that is important in your life that is spiritual to you. So it's very important when you talk that you mention things like people, tasks, environment, relate what you're explaining to the person you're talking to. If they say, yeah, you know, my mother broke a hip last year, talk about all the things that OTs do with people that break hips. If they say, my sister has a child who has autism, and I know that the child gets OT, talk about the occupation of learning. So try and relate it to, if they bring it up, ask them, inquire about their experience with OT, relate it to that. And then finally, talk about what occupations are. You know, you can say, yeah, you know, occupational therapy, sometimes we argue about the name, but occupations are important to us in a different sense. And this is what we mean by occupations. Occupations are the things in people's lives that are meaningful and purposeful to them. Occupations are things that people need to be able to do or want to be able to do in order to make it through their lives and be happy, content, and live a meaningful life to them. So we look at what's important to the person, and we try and either change tasks, the person, the way the tasks are done, or the environment. Those three things to enable people to be able to perform those important, meaningful occupations in their lives. And hopefully you'll never need occupational therapy, but there's also a wellness and prevention side to it too. We do, you know, we help people with, you can talk about all the mental health stuff, with balancing life, you know, work and leisure, and you can say, I've been told by, you can say one of our members is a Robert Wood Johnson Health Policy Fellow, and she says that nobody on the Hill balances their work and their leisure. And so that's something that you know, occupational therapists do. We work on relaxation techniques, getting organized, kind of figuring out ways to prevent stress, stress management, preventing you from getting a bad back when you're carrying the senator's books and materials and suitcases, those kinds of things. So, you know, if you can try and relate it to, you know, wellness and prevention as well, that would be good. If you want to mention, I know that Dan said someone was going to mention this, the role with the military, that's also good. I don't know if you know what committees the people you're visiting sit on, but if someone is on the Department of Defense committee, the DoD committee, or some of the committees that deal with defense issues, VA, there's a very big role with occupational therapy and returning soldiers. And we know that all of them have just about, I'm not speaking from scientific evidence, I'm speaking from what I see and what I hear, so don't quote me on that, but all of them have had some sort of traumatic brain injury, concussions, and probably repetitive concussions from all of the IEDs that are going on. So there will be roles for occupational therapy in the future, in addition to all the people coming back with amputations. And you can tell them there are wonderful occupational therapists in the military doing amazing things, and when all of those people are discharged, it will be the rest of us who are doing, you know, who are working with those soldiers and helping them adjust to getting back to a normal life and being able to do things that are meaningful and purposeful to them. Guys, is there anything else you want me, should I ask questions? Okay, questions?
Does anybody want to know how Barbara became fellow? You could spend a year up here at Capitol Hill. Barbara, how did you become the Robert